2NURFM.com, a broadcast service of the University of Newcastle.
Emeritus Professor John Hamilton was Dean of the School of Medicine here at the University of Newcastle from 1984 to 1997. A medical educator of international renown, Professor Hamilton is a leader in accreditation of medical schools in Australia and worldwide, and he joins us here this morning in studio. Professor, welcome.
Thank you very much indeed.
The university celebrates 50 years, as you're well aware. Tell us about how and why you came to be involved with this university, Professor Hamilton.
Yes, thank you. The medical school is 40 years old as well. I first knew about Newcastle when the medical school started in 1975, and David Madison, the very capable and inspiring first dean, visited McMaster University, where I was then actually chairing the curriculum, which was the one that introduced problem-based learning, which is of note.
Is that in Canada?
That was in Canada.
Yes, okay.
And several senior people who, as they became here, Stephen Leader, Bob Clancy, were there, so I knew them. And David and I talked a lot about curriculum, and then he returned, and Newcastle, McMaster, numbers of other schools formed a network of cooperation to develop new approaches to medical education. And here, in Australia, that was built on the Carmel report that recommended new changes, widening view of medical education, better selection, better social orientation. That was the agenda for a new medical school. And David was appointed because he could see, and everybody saw that match of him and a new initiative would be tremendously creative, which it was. Suddenly and sadly, he died in 1982. And so people were inquiring for folks who knew a bit about this sort of thing. So that's how it came to be that I was asked to come. I was with the World Bank and had already been setting up a medical school in Nigeria at that time. So it's a lot of left-hand, right-hand bends.
Yes, so you're not a doctor yourself.
I jolly well am.
That's what I was trying to get to that point. When you said you'd been with the World Bank, it threw me.
Well, I was in the Public Health Nutrition Division, which was opening up World Bank to social health, nutritional development elements of life.
Excellent. And really that report that you spoke of a moment ago, it really flagged the fact that we needed doctors, as you say, from a broader scope to have that communication with patients, and problem-based medicine and the idea of expanding one's mind rather than rote learning was the key? Yes,
the problem-based learning was developed. The details are complex, but so that students were not passive learners. These are not new ideas. They were actually embedded in the report of 1910 by Abraham Flexner that redirected medical education in North America.
Okay.
But the idea was that you tackle a problem, you remind yourself what you know, what you need to know, and then you learn in relation to that problem, not simply to solve it, but to understand the mechanisms you need to master, the interpretations, the way to communicate your understanding of it, and so on. And you work in small groups, and so you learn from each other. So when you select students with a wider background, you create a community of scholars of a diverse background, which is very constructive.
And that teamwork approach filters through into the hospital system and into general practice and specialisation as well.
It was interesting that when students were first, in the early years, going out into hospitals, nursing staff said, these students are much, much better at listening to patients, not just talking to them, listening, understanding the circumstance of their lives, being open to other members of the health team, having a wider view of medicine than just the narrow academic side. Exactly the same thing said about students in Nigeria who'd lived in villages for every month, and our students were going in an equivalent way into rural areas and small communities here, so that they would go into the real world, not just the teaching hospital.
And bring better health and education and medicine to the general population, I'm gathering.
A lot of emphasis on general practice. And it's interesting that as time went on, a review of general practitioners from Newcastle showed they have a much greater satisfaction and greater sense of purpose in their general practice than did graduates at that time from other medical schools. But of course, Newcastle became the point of reference for many new things. So the many things that were done here including problem-based learning, including rural things and so on, started to be generalized around the country. And we had people visiting month after month from all over the place, World Health sending people. So it had a big impact nationally and internationally.
Emeritus Professor John Hamilton joins us this morning on 2NUR, talking about the setting up of problem-based learning at the School of Medicine here in Newcastle. Professor Hamilton, talk to me about some of your fond memories of the time that you've spent here at the university. Does some things stand out to you?
Yes. The first thing was not such a fond memory of wondering what on earth we'd done coming all this way, as one does, and so on. But we settled in. We were very warmly welcomed, I must say. And the students were very dynamic. That was very good. The interacting closely with the students and tutoring them and so on was a very valuable thing to do. And then getting out into the community and finding, and I'm still doing, I'm now putting students into the welfare sector so they see what the real world out beyond the reach of medicine is. Very much the first intent of the school to do that. Very much the Whitlam government, in whose time this report had come. Of course, that government was stopped in midair.
Yes.
But it takes medicine to have a much larger role in welfare, well-being, responsibility, responding to patients and so on.
And can I ask what you're doing these days? How are you filling your days? I'm sure you're still very busy.
Yeah, well, I am retired, but nobody seems to take too much notice of that. So
Right.
I do chair the final 2 years of the medical school, the two curriculum in the hospitals and general practice and so on, for years 4 and 5. And now, of course, for some 8 years, we've had a partnership with the University of New England. So the numbers of students now are altogether much bigger. And they are developing rural perspectives on healthcare up there, as we are doing here. And I'm pushing several elements of special studies for students into the welfare sector or in special areas they may not have seen in the curriculum closely, so they can go into depth in certain parts of elements of medicine to understand and get a deeper understanding of those selected areas. And that's giving them a good education.
It sounds as though you are very hopeful for the future of medicine and our medical graduates and the community's interaction with them moving forward.
Yes, and I think the more the community becomes engaged with the education, the better. That's what I've learned internationally. I set up a medical school in Durham, England, where we use the welfare sector as the major focus.
Wonderful. Emeritus Professor John Hamilton, thank you for your time, and I dare say you'll be catching up with colleagues from former years at the gala reunion.
I look forward to that.
Thank you so much. Emeritus Professor John Hamilton joining us this morning.